many things, many things, and but it's taken us it's a bit of a journey, which how we've got here today. And so hypnosis is something really close to my heart, because I'll tell you a bit of my story. So I'm a GP over in Exeter. A few years ago, I graduated in 2001, became a GP in 2006. Realized I didn't know enough to do what I needed to do as a GP. So 20-25% musculoskeletal problems, and psychological problems for probably another 50% or something, and at least. And there's a lot, and in MSK, musculoskeletal, probably a lot of interplay. And I wasn't adequately trained, so I went to do acupuncture, that was great. Went to learn NLP, a bit of hypnosis. I tried to learn CBT, motivational interviewing, didn't quite like. I liked motivational interviewing, CBT not so much, didn't suit me in particular. Anyway, it all made my consultations more efficient, faster, better. I thought it was great. So, but then I worked harder, worked more, because that's what you think you need to do. You work harder and you work more. And then one day, this happened to me about 5-6 years ago, right? Anyone knows what that is? Yeah. Why is it a Bell's palsy? No, never mind. So I couldn't move my. Don't have wrinkles anyway, but I didn't have wrinkles at the top there, so that was a Bell's palsy. It wasn't a stroke, so that's great. And that was the first night that it happened. And Rachel, sitting here, very kindly came and helped me out that night, because I was looking after my son on my own and working full time and weekends. It's a bit crazy. So anyway, that happened. But it's okay. Bell's palsy improves 95% of the time. Doesn't matter how bad it is. Within 4 weeks, 90-95% sometimes. Within 4 weeks. So nothing happened in 4 weeks. Nothing happened in 2 months, 3 months, 4 months. And then this was me the day before that it all changed. This was me, exactly the same. I improved very slightly. I could blink. You can't see it, but I couldn't blink there. Like it's sort of half blink. And this is wonderful ability of your eye to just go up when you go and close your eyes. So that's a name for it. And it's so I didn't need to take my eyes shut anymore, which is what I needed to do initially. Not very nice. And anything that affects your face affects the rest of your life, unfortunately. So visible, couldn't smile. If people sat on the wrong side of me, they'd think I was upset the whole time. Right? Even now, it hasn't fully recovered, so now you know, and you'll be staring at my face all the time. But the interesting thing about it was how it recovered. Because I went on this course, this advanced NLP course, and I didn't realize, I know I liked it before. I didn't realize that it was going to be entirely in hypnosis, and then suddenly, so this is me, not same year I think, or the year after, or something. But I have a photo that 2 days after it happened. But instantly, I can tell you, on step in front of everyone who was on the course, my face began to move. Right, and I thought, whoa, what's going on? And the question is, how did that happen? I'm not saying it'll happen for you. I'm telling you what happened to me. And there's been lots and lots of talks today about the things that complementary therapy can do with medicine fields and things it's impossible. We were just here earlier, Amanda was showing us a picture of when she put the needles in and someone with a stroke started to move their hands and fingers. Well, how is that possible? My nerve still doesn't function. I can't taste on one side of the tongue. When I touch myself with a tuning fork, it's louder on this side. And it's crazy. But yet, when I smile, I have a crease. It's absolutely mad. So then I thought I had to learn more about hypnosis. So why learn about hypnosis? Because you can make people do what you want them to do, maybe. Is that why you're here? Yeah. Maybe it's not that hard to learn, actually. Maybe it's not that hard to learn. So what I'm going to do today is tell you a bit about the boring science of hypnosis, and then what I'm going to do is do a little demonstration for everyone. There's a little light-hearted show, right? To get a few of you up here, and if you want, or you don't come if you don't want to, but it'll just be a bit entertaining, and it just shows you, and then I'll do a big reveal at the end. I'll tell you what I did, and I'll tell you how you can use it in practice, right? In what I do in a 10-minute consultation. So you have ways to squeeze hypnosis in. Some of you have come up to me saying, how do you squeeze it all in? So we have techniques to do that. Because Naveed and I sat down and said, oh, traditional hypnosis, we both went on year-long courses for it, far too slow. So we had to adapt it, and so that's what we've done. Because most of you are doctors and therapists, anyone from the public? Yes, one or two, yes. Right, so, but anyway, if you just read this quietly, and don't worry if you can't finish it. Everyone read the last line, yeah? Okay. So there's something called the mind-body connection. Everyone who's in this room understands that it's possible. I didn't when I studied medicine, to be fair. It didn't occur to me that how your physiology, what happens to you if you're in pain, that it would affect your mind. Because I was never ill, right? And I was young, and I was like you guys, a teenager. I thought I'd study the science and everything would be fine. But it turns out that it's not that way, right? How you think and how you feel clearly affects the physiology and your physical state. And we know that that's true, and if anyone doubts that, there's so much evidence out there, there's no point being here if you didn't think that. But the question is how much and how. That's because it doesn't always work and how you affect it. So anyway, my experience with hypnosis is what I use it for. I use it for IBS, anxieties, phobias, and it augments any treatment, any psychological technique, anything you tell them, it's better in hypnosis. And I'll tell you why. And I learned from Amanda, who was here earlier, if you were here, you didn't see something. She told me something really amazing. Why does hypnosis work so well for skin? Why do psychological problems, why does stress affect the skin so much? And Naveed really wanted me to share this with you, because it was like a whoa moment. And so one day I was teaching my registrar, I had my embryology book in there, and I thought, oh God, this is a boring consultation. So I opened up the embryology book, and I went back to look at your cell layer, germ cell layers. You've got the ectoderm, the mesoderm, and the endoderm, of which forms everything in your body. So the endoderm forms the insides of your body, the mesoderm forms the organs, the muscles, the skeleton, and the ectoderm forms, you would think, the skin, right? But it forms two things. It forms the skin and your brain and your central nervous system. And I don't know how I missed this and how it wasn't pointed out in medical school, because we all learned this, didn't we? And we just ignored it. For years and years on end, we just ignored it. And you think, well, what? Anyway, so it was quite a moment. So what is hypnosis? What is this hypnosis? So scientifically, we've sort of done a lot of research. There's a guy called David Spiegel who's done a lot of research over in America. In fact, he chairs one of the integrative health committees over there. And he's he's a professor at Stanford, done lots and lots of brain imaging, because brain imaging sort of helps us learn a lot more things. But what we do know now is it's not like you're in a trance and you'll make you do everything you want, whatever. But it's a state of focused awareness. So all of us go through these states. Although some people are highly hypnotized subjects, it's all a bell-shaped curve, and you'll soon learn that here. Who's on which side of the bell, right? And but it's a state of focused awareness. What I mean by that is all of us have had this experience where we concentrate so intently on something to the exclusion of everything else. Yes? You're just caught in a moment, stuck in a moment, just everything else just fades away. And what we know and that's really the goal of meditation, focusing on one thing, and then ignoring all the rest. And then eventually, even that one thing might disappear for a second. So it's a state of focused awareness. All of us are capable of concentrating. The only thing that'll stand in the way is ourselves. So all of us go into these states. But there are certain parts of the brain that are affected. So this is David Spiegel's favorite slide, I think. He says, so that's a play on word, transformation of control, transformation of control over language and perceptions. He says in ordinary consciousness, we respond to perceptions and manipulate language. So, and then we'll talk about perceiving the world very shortly. And in hypnosis, we respond to language and manipulate perception. Now that's weird, but you'll understand it, not yet, but in a moment. So, a bit of the science, what happens, and the way they do the science, they find highly hypnotizable subjects, highly hypnotized people, and they are, again, like I said, this bell-shaped curve. Some people go into a deep trance. I have got better at it. You can train yourself to be better at meditation. You can train yourself to be better at hypnosis. Has anyone here ever been hypnotized? Yeah? Okay. Yeah? Good.
The Indian version, yoga, you know yoga nidra? This was the Indian, I think, the yogic sleep as well.
Oh, wonderful. Yeah. So many of these things are very similar. They evolve what they call altered states of awareness. You can have lots of research into other altered states of awareness, but we're not going to talk about that. This is legal. Altered states of awareness. So let's go back. So what they found is that in these subjects, areas of the brain that are affected are areas responsible for attention. So all this stuff doesn't mean anything, but basically they are areas of the brain associated with attention. Do you know what the Stroop effect is? Everyone heard of the Stroop effect? Yes, go on. Did you nod your head? So Stroop effect is this test they do with alcoholics and stuff. So they have a word that comes up in a different color, and then you're supposed to say the word and not the color, or the color, not the word, and then. But people find it quite difficult, and there's a delay, and they measure someone's attention by the delay. But in hypnosis, almost 100% of the time, they'll swap it. They'll just keep saying, they'll say green, and it'll be green, and they'll say red, blue, or whatever. And you can change the colors 100% of the time. So it's not to be used. It's really weird. And I'll explain to you how I think conceptually how it might work. And the other thing that's really interesting is that when you're hypnotized, it stops the default mode network from working. Does anyone know what the default mode network is? So in fMRI studies where they measure optical glucose and which part of your brain is working more, so compared to the other parts, it settles before every experiment. They go think about nothing. We haven't started the experiment yet. And yet, there's this part of your brain which the lights always go up on. And these are parts of the brain very strangely correlated with anxiety and depression. Really strangely. So we're designed to worry, because evolutionary-wise, we're not getting eaten, are we? So we don't want to get eaten, we don't want to get eaten, we worry about getting eaten. And so it's got, but yet we're designed to worry. We've nothing to worry about these days, almost nothing. And we worry unnecessarily. But when you're doing something, you stop worrying. And what they find is in hypnosis, people stop worrying. It co-varies inversely with DMN connectivity. So it's really weird. It's like a fast-track meditation. So those of you who may come up later often have done, people who are good hypnotic subjects, people who are better hypnotic subjects, meditate and go into deep states of meditation. And that's really cool. So how do we perceive the world? So we'll just talk about perception of reality. How do we perceive reality?
Senses.
From the senses, yeah. What you see, what you hear, what you feel, what is in touch, and what you taste and what you smell. But less so about taste and smell. Like they've shown that mainly what you see, what you hear, and what you feel, right? And we sort of connected to something called the triune brain theory. Has anyone heard about that? So Paul MacLean in the 70s talks about the reptilian brain. Have you heard about this? The reptilian brain and then the emotional brain. So reptilian brain, say your brainstem, and your emotional brain contains your thalamus here, so emotional, sorry. And then the logical brain is your large prefrontal cortex, massive prefrontal cortex. In fact, we're born with an incomplete prefrontal cortex. We have to be. So in Yuval Noah Harari's book *Sapiens*, he says, we're one of the only species where we're born before we're fully developed because our brain is so big, and yet so big, so much bigger to grow. And the really primitive reflexes that are needed, say reptilian reflexes, what you need to survive, what does a baby do? So babies pee, poo, eat, sleep, right? Cry. Yes. And smile, yeah, and smile. So there's primitive reflexes. They don't learn to smile right away, though. It takes some time before they smile, doesn't it? They don't really necessarily need to smile right away. So they don't learn to smile until 6 weeks, as we all learn, right? So that's not, and then they develop the emotional brain, and then develop, but not all brains. What Paul MacLean says, not all brains are equal. Your primitive brain trumps your emotional, the more ancient brain. Your primitive brains trump your logical brain. Do you agree with that? Because if you felt unwell and you felt depressed, and depression very strangely occurs in this area, your emotional brain, very strangely. And so, if you can snap yourself out of depression and you say, "Oh, just be happy," or "Don't be depressed," you think that's going to happen? Yeah. Otherwise, we wouldn't have a job, would we? So it doesn't. That's right. So it wouldn't. It doesn't. It doesn't rule true. And as much as we try, but sometimes you can. Sometimes you can pound it hard enough, like with CBT. I have a thing about CBT. I try again, it's really hard. And so you pound it hard enough, and you keep telling them, "Look, you should stop. And then eventually it stops. I think there's a Benny Hill one, isn't there? That's a really funny thing, which is stop it. And so eventually, you get so fed up that you work through it. But it's not necessarily a permanent cure. And that sort of corresponds with Daniel Kahneman. Anyone read Daniel Kahneman, Thinking Fast and Slow? Daniel Kahneman won the Nobel Prize for economics, but he's a psychologist. And he talks about System 1 and System 2 thinking. It's a really boring book if you've ever read it. But he has this amazing concept that he talks about the System 1 thinking, which is the automatic thought, and System 2 is considered thought, is logical thought. So we think we are System 2. We think we are logical and we are rational, but actually we're just stupid, right? And so Daniel Goleman, anyone knows Daniel Goleman from Emotional Intelligence? Yeah? So he talks about the high road and the low road. So high road, again, the same thing. And so what we believe hypnosis does for you is it relaxes you so much, and it tends to be associated with a state of deep relaxation, or it stops that part of your logical brain thinking enough for language to go in, like what Spiegel says, to start to influence these parts. And one very, very interesting thing before we go on to the demonstration is, what do babies do? We said they eat, they sleep, they pee, they poo. All right? What are the problems that are the hardest to treat? Hardest, I've done a lot of, I'm sure a lot of you have treated problems. Eating disorders, sleep, insomnia, sleeping disorders, really hard to treat. So, and then there's things like irritable bowel syndrome, and dare I say, interstitial cystitis as well. Sounds like it's a medical word, but if you look at interstitial cystitis, there's not much in there. And it's pelvic pain syndrome, where it's just irritable bowel. They're treated with, so the gynecologists say, oh, it's some sort of gynecological problem, but we'll treat it with linseed. And I don't see how linseed can affect your gynecological tract. So it has to be affecting your bowels. And anyway, so these are the hardest bits. So how do you treat that? I don't know. What's the answer? But maybe hypnosis does something for you. Because I'm still trying to figure out how hypnosis worked for me. So I don't quite know. Although sometimes things happen under hypnosis that you cannot explain. If you've ever been hypnotized, and some of you hopefully will get the opportunity to very shortly, and you will get the opportunity to, you'll be able to experience it. So, what does hypnosis do? It allows you deeper states of relaxation. Much like if you listen to those hypnotic tapes and relaxation tapes, and it allows us to take on suggestions to influence our mind fully. And that's what I think hypnosis is. Now, before we go on to a demonstration, there are a few myths on hypnosis. Everyone thinks it's sleep. It's not sleep. Sleep, I've been reading. Sleep involves Matthew Walker's book on sleep recently. God, it's a long, long book, and I don't know how it's a bestseller because it's really scientific. It's worth looking at. Anyway, I've been looking at the neuroscience of sleep. Sleep's very interesting. You get complete paralysis of your body, and your brain's just like working through the day. So they said if you weren't paralyzed, you'd be walking around reliving the day and learning. So sleep is not sleep. Only certain parts of your brain are active in hypnosis. It isn't, same with meditation, it's not sleep. Sleep is a different process. So you will wake up and you're not asleep. You'll be able to hear, in fact, you'll be able to hear things more acutely, and you'll be able to hear everything if you wanted to, or you just don't care about everything else and just listen to the sound of my voice. Right? And waking up, so because it's not sleep, you won't wake up, you just open your eyes, right? Or just walk out of the room if you don't wake up, and then eventually you'll just get up and you go, I need to pee. So don't worry about that, and control, right? So I promise you at all times that your clothes will remain folded in a neat pile in the corner. Right, so under hypnosis, you won't do what you wouldn't normally do, right? Because you'll think that's just absolutely ridiculous. And the people who get up on stage in pubs and clubs, in freshers, fairs, which apparently I heard a lot of that happening recently, who want to get hypnotized and they do silly things. It's because they've had a few drinks and they expect to do silly things. You guys just might want to do one or two silly things, but not please. There's no nudity today. It'll be PG rated. So we'll do a little demonstration if that's okay. And what we'll do is we'll then measure everyone's hypnotizability, if you would like, or suggestibility. Right? And it doesn't mean that you are weaker minded. It just means you can concentrate more. And what we found by doing this talk over and over again to doctors, a lot of doctors, because that's what we are, and we give talks to doctors who don't believe in this, is that there are a lot of them who study a lot and study well, and they got where they are because they can concentrate well. And again, lots of complementary therapists have practiced with meditation, so they're good at it. And again, something about, and some people just are, not aware that they are. So, shall we begin, right? So what I normally do is just show you a little trick, just a little trick. But what you have to do is listen to the instructions very, very carefully, right? And if you don't do it right, then you haven't listened to the instructions. But if you think about what I've said, you'll understand it. So anyway, I want you to clench your right fist, hard as you can, and then rest it down on your lap, right? Tight as you can. Tense all the muscles until they're really, really tense. Right? Got it? Are you sure? Really tense. Okay, just relax them completely now. So that's the quality of relaxation I like to get all over your body when you get hypnotized. That's the quality of relaxation all over. So the best place to practice that is around your eyes, because when you go to sleep at night, you practice that all the time. You relax your eyes and you go, yeah? So can you do that for me? Can you relax all the muscles around your eyes? Can you relax all the muscles around your eyes so that it just won't work? Okay? And when you're sure that they're so relaxed, all the muscles around your eyes are so relaxed that they just won't work. Go ahead and try to open your eyes and find that you stay stuck, shut. Okay, you can now open your eyes. So a few of you had some strange reactions there, didn't you? Yeah? And those of you think about, I'll talk to you about that later. So the next thing I want you to do is to grab, so just put it in front of you, clasp your hands like that. Clasp your hands together like that. Fingers together, palms together, until they go white. Really, really hard. Fingers together, palms together. Yeah? Yeah? Now, can you stare at them? And then, okay, have a look here first. I'm going to tell you what you need to do. Take your index fingers, put them apart like that. Now, look, when you do that, look in the middle. Put them right in front of you. Maybe that's easier. Right? Look right in the middle and watch as they come closer and closer together. Watch closer as they come closer and closer. Closer and closer. In fact, if you think it's a trick, move it apart and watch as it comes closer. But you have to concentrate right on the middle. Okay? It's all right. Go ahead. Leave them there. Okay. Keep looking right in the middle. Concentrate really, really well. Okay. As you're concentrating there, just imagine that there's super glue sticking the fingers together. But you've got to look right in the middle. Imagine that there's super glue sticking the fingers together. So either your front is stuck more or the back of your fingers is stuck more. Just imagine them being stuck, and then that feeling of being stuck, doubling, and doubling even more, right? Okay, once you've imagined that, you go ahead and try to part them. Try to part them, and find that some of you have it still stuck together. And in fact, the harder you try, the more stuck they get. And I'm just going to keep trying. But if it comes apart, it comes apart. But some of you, it's going to be stuck, right? Okay, those with it remaining stuck, put them in the air, and I'll unstick them for you. Okay, good. Are they still stuck? Okay, unstick them. Why don't you come up here? So those of you who are still stuck, come up here. Okay, so just you. It's gone. Well done. Yeah, it took a while, didn't it? I had a patient of mine who, I did a show with a GP of ours who it didn't get unstuck, and that was a bit of a problem. I've developed other ways to unstick people. Good, so well done. Right, so do some of you who had it still stuck together, do you want to come up here? Maybe, should we say 3? We'll have you definitely, because you'll really like it. Coming up? Move back until we can get some. Okay, good. Fun, wasn't it? Yeah. No, not yet. You're curious. Yeah. You've been hypnotized before?
No.
So can I get your names? Anne.
Kate.
Anne, Kate.
Teresa.
Anne, Kate, Teresa, Kate. Okay, good. Thank you very much. Anne, Kate, Teresa. Okay. So, like I said, but do any of you meditate?
Yeah.
Yeah?
Yeah.
Yeah, good. Any of you doctors?
Yeah.
Yeah, okay.
I'm a psychology doctor, though, not
Doctor,
medical doctor.
psychologists will be fine. Doctor, psychologists. No big deal. Have you been, so you've been hypnotized? No, never. Okay, it's great. Good. So it just shows that you can concentrate really, really well. So next thing I want you to do is, you remember that feeling that it was really, really stuck? Yeah? Can you all remember that? Good. Right, next thing I want you to do is put your hands up 6 inches apart. Oh, I don't know. Is that, who's been telling you that 6 inches? That's 6 inches. Okay. Oh, you just got it now, have you? Okay. That's a bit slow. Okay.
I'm just concentrating on my hands.
Oh, yeah. That's right. So if you concentrate just right in the middle, stare right in the middle, not yet, stare right in the middle, a bit further up, further up, further up. Okay? Look in the middle and watch as they come closer and closer together. Closer and closer, closer and closer. Watch as come closer and closer together until they touch. Slightly closer together. Every time I say the word close, they come closer and closer still. It's really weird, isn't it? So take a deep breath in and sleep. That's right. Deeper and more relaxed. Get that relaxation you have around your eyes. Go from the forehead to your shoulders, to your arms, all the way down to the tip of your toes. You can just want to make sure everyone can hear me. And sleep. That's right. I say and relax. Then you can close your eyes too and relax. Now, go deeper and deeper down. Feel that relaxation again from the top of your head to your arms to your shoulders. That's right. All the way down. In fact, the more I rock you, the more relaxed you get. The deeper relaxed you get, the better you feel, the deeper relaxed you go. That's right. And you know how good it feels now, because it's been a long day. You never really get to relax. That's right. And now you can take this opportunity to just close your eyes and go inside and relax even more. And the way you can get even more relaxed, is in a moment, not yet, but in a moment, when I ask you to open your eyes. When I ask you to open your eyes, when only I say the word sleep, your eyes will close, you allow yourself to go 10 times deeper than you are now. Nod your heads if you understand. That's right, that's because they're awake. That's at the same time. So open your eyes and sleep. That's right, very good. Open your eyes again, Teresa, and sleep. That's right, 10 times deeper, 10 times more relaxed. Don't worry, you stay in your chair the whole time. 10 times deeper, 10 times more relaxed. But you know what's better than 10 times? 100 times, and it's 100 times more deeper, 100 times more relaxed. So open your eyes again and sleep. That's right. Let yourself go deeper and more relaxed. Stay in your chair. Thank you. That's right. Open your eyes, Teresa, and sleep. That's right. Go deeper and deeper. Floating, dreaming, drifting to a wonderful, safe place deep inside, where you, in perfect confidence, safety, you can explore what you really want to. And so, see, in just a moment, it doesn't take very long, it's about spotting those moments that there are, and I'll tell you about it later. So you guys aren't missing anything. You'll learn everything that's happening now. But the only thing that you're doing is you're concentrating on how deeply relaxed you are. And it's a very simple way to go deeper relaxed. You just double your relaxation with each descending number. So with each descending number, as I come back from 10 to 1, you double that relaxation, going from 10 to 9 to 8. Deeper still, doubling that relaxation to 7 to 5, 4, 3, 1. So deeply relaxed now. Because when you're deeply relaxed, you begin to be able to concentrate really, really hard. And really, really deeply, really, really easily. Not hard at all, really easy. And one of the things that you can go back to is a really funny memory, really happy memory, right? Can you remember a happy memory? So I'll come back from 5 to 1, and count of 1, you'll be at a happy memory. Really funny memories can make you laugh and giggle and chuckle, right? 5, 4, 3, 2, 1. Okay, that's right. Have you found a memory yet?
Yeah.
Okay, good. And it's getting funnier and funnier, funnier and funnier still. And you know how memories sometimes are long, faded away, and some sort of, if you make the colors brighter and the picture bigger, zzz, it becomes even funnier. Zzz. Every time I touch you, it goes zzz. 10 times more, zzz. 100 times more, shoo. Shoo. But it's good because you remember it clearer. Shoo. And good memories trump bad memories. If you think about a bad memory and you go, shoo, it goes away, right? It's okay to giggle. That smile continues to giggle. It's okay to smile and laugh. It's not that happy a memory. Find another one, a funnier one.
It's funny for me.
It's funny, okay. Funnier still, funnier still. You don't have to tell us what it is. The thing about hypnosis is you can do it all in your mind, and no one else knows what you're thinking. And so you can do something in NLP called collapsing because you have a bad memory and you have a good memory, right? And then that memory disappears because you've changed how it works. But there are other things you can do as well. You can keep that memory with you. Okay, so open your eyes again, Teresa, open your eyes, and sleep. Now go deeper and more relaxed. Knowing that you come back to the state anytime you want. Again, open your eyes and sleep. That's right. Wonderful. And you just enjoy the deep state of relaxation. Kate, I'm going to ask you to just take a deep breath in, open your eyes, and sleep. And you really enjoy being relaxed. Meditate, like a state of meditation, but much deeper still. Coming back anytime you want. I'm going to leave you here to relax. So I'm going to ask Teresa to now open your eyes, Teresa. How do you feel? Relaxed? You're good? Yeah? Okay, what I'd like you to do is come up here for me. Okay, steady on your feet. Okay.
Okay.
And just over here, I've only got space for you, so because you can concentrate really well, is to put your right foot in front of your left foot, like that. Further in front. Excellent. And I want you to stare intently at your foot. And just like you were imagining your fingers getting stuck, I want you to imagine your foot getting stuck to the floor. So which part of your foot is stuck more? The right, the top, the ball of your foot or your heel? Top or your bottom? Which one's stuck more? Test it, go ahead and test it.
Heel.
Heel. Okay, make that double, and then go to the front. And now it's doubly as stuck. Now you can try as hard as you want, and try to move it and find that you can't. But it's just stuck. Strange, isn't it? Are you hypnotized?
No.
No? Gosh, what's this? So all I did was go through a sequence of events, which I'll show you, and a pattern of speech, and then she suddenly stuck to the floor. But that's really, really funny, because you can actually stick that foot as well. And you try to walk out. But your husband's over there. I should say hi to him. There he is. He's saying, are you sure? But very strangely, same thing that can happen is because you can imagine the stickiness in that hand, in that foot going up to this hand and going, and now sticks to your head.
I think you learned this.
You can really try to lift it out and you find it's completely stuck, isn't it?
Mm-hmm.
But yet you're fully alert. And patients do this all the time. We catch these states and we don't watch for them. And we can influence them very, very easily with suggestions that I've just given her suggestions.
Could you
And we're
imagine
using the wrong
someone
speech.
can get frightened?
And you can get frightened.
But I'm okay with it. I'm totally okay.
Yes, that's right.
Yeah.
Because at the same time, because you wouldn't do it if you weren't okay with it.
Mm.
But people are too afraid to say anything about doctors making bad suggestions. But we're going to make good suggestions, because just as easily as you can get stuck, and people get stuck all the time, don't you? That's what you do.
Mm.
People get stuck just as easily. When I snap my fingers, it relaxes. And it releases. And you're fine. Right?
Yeah.
And so who was making you stick?
Not you.
Not me. Exactly. Good. If you
Thank you.
have a sleep. Because we don't have much time, it's just a little humorous demonstration of what you can do with hypnosis. But I didn't really do hypnosis, I just had a pattern of speech. So sleep. That's right. Deeper, more relaxed. Sorry. Deeply relaxed. Stay in the seat. Deeper, more relaxed. Deeply, more relaxed. Deeper, more relaxed. 10 times deeper, 100 times deeper, knowing that you can come back anytime you want. In a moment, I'm going to come back from up from 1 to 5. On the count of 5, you'll be back to room, awake, alert, feeling absolutely fine, feeling great. I'm not going to make you do any more things, but each time, and any time I say the word sleep, you'll be able to go back into this state instantly, automatically, only if it's safe and appropriate for you. Okay? So, 1, getting more and more alert. 2, taking back only the wonderful memories, only the good memories. 3, knowing that you can come back, like I said, anytime you want. 4, remembering that all I have to do is say the word sleep and you go straight back into trance. 5, open your eyes, remembering everything, learning everything you've learned. Okay, good? Feel good? Feel energized? Feel great? Yes? Like you've slept for ages.
It's been great.
Hasn't it?
I said to her, can
Okay.
you have naps?
So, that's right. Good, that was great. Sleep. That's right. Right? So this is how I do it in 10 minutes. So you see it the first time, you invest some time, and sleep. That's right. Deeply more relaxed. Not so much, but you sleep. That's right. 10 times deeper, 10 times more relaxed. So easily relaxed. Okay, good. And 1, 2, 3, 4, 5, back, awake, alert, feeling great. Yes. You can go back to your seats. Right, and I'll finish up. Did you find that a little entertaining? But it sort of demonstrates what you can do with a lot of hypnosis. the unlikeliest influence is possible. You know, you didn't expect that. They didn't expect that. But it was fun, and it wasn't me doing it. It was her doing it. And all I did was a sequence of events, pattern of speech. They can be easily learned. And if you can manipulate the mind, you can change the body. Okay? So all I did was say a few things, and then she had physical changes that she thought were occurring that also could resolve themselves. Have you found it useful? Useful? Not really, because I haven't told you how I did it yet, have I? Did it feel good, those of you hypnotized? Yeah? What a way. So, that's time's up. It's the last one of the day. Do you want to find out what I did? How I did it? Okay. So, very simple. What we did was what is known as pacing leading in NLP. So what we do is we get you to agree. If someone agrees with you enough times, they're going to say yes. Get so used to saying yes. How could I tell you guys were good subjects? So not all of you were, but some of you were. And it's because from here I can see some of you who were good subjects. Yeah, didn't come up, maybe because you were embarrassed or so and so. It's not, you know. But and the way I can tell is because you don't move. From up here I can see swaying, normal swaying occurs, physiological swaying, physiological moving, fidgeting. People who are highly hypnotized subjects do not do that. They just stare and they're like, just like when people are in movies. Right? So that's what and sometimes if you remember your consultations with your patients, sometimes they're just staring at you, aren't they? Like and those are the times you can fire your suggestions off, good suggestions, because there's nocebo as well as placebo. Right? So you pace, and now you call it pace, and lead. So at the end of it, so you can, once you realize that you've got this rapport is connection with someone, you can then take charge and then lead the consultation. And the best way to use it is they have to leave the consultation happy. Have you noticed this? If you're a bit upset or angry, they're a bit upset and angry, and it just doesn't work out. And you leave the room and you feel really stressed and you need to go do your housekeeping, right? This is what they teach you in medical school. You do your housekeeping afterwards because you've got to console yourself. But you could have done it the whole time. If you connect enough, but you can't connect to everyone, but if you can connect enough, you leave the place happy, and the patient's going to be happy. You're both smiling and laughing, and that's what you want. Good consultation. So the secret is rapport. Right? Secret is rapport. So I'm going to do two things about what I did. I used two forms of language that I'm going to teach you now, which is exactly what I've been doing, using the whole time. There's two forms of NLP, what we call presuppositions and double binds. So presuppositions, I said, when you're sure, so let's go back to the eyes again, when you're sure your eyelids are completely relaxed, when the muscles around your eyes are completely relaxed, when you're sure, what does that presuppose? That you're sure, right? That you're sure it's completely relaxed. That it just won't work. Go ahead and try. Try then introduces, I didn't include try here, but try is a bad word. Try introduces the concept of probability of failure. Right? So anyway, so when you're sure, and those of you who opened your eyes obviously didn't listen to the instructions properly, did you? And that's what I would do. In surgery, I would just say, do it again. Do it again. So, and then I would say the same thing, and I'd say, listen carefully. And people get it, and they learn it, and they don't feel bad about it. Right? And then I use double binds. Double binds the whole time. Right? Which part of your foot is stuck more? Like, which part of your foot is stuck more? Right? So that's a presupposition, because it presupposes your foot is stuck. Yes? Is it your front, or is it your back? Right? So, are you going to have your peas before or after dessert, your main course? Yeah? So, let's not talk about chips. and when you're going to change your pajamas, the bathroom or the bedroom. We use it in children all the time. We know, but you can use it on people. For example, would you like, I don't have much, okay, I've still got five minutes before 5 o'clock. Do you want to know how I use it in practice? Just the language. So hopefully you've achieved great rapport. I prescribe antidepressants. I'm not ashamed of the fact that I prescribe antidepressants. You know, I think a lot of people who are against antidepressants, but I think they have a place. They have a place. And I prescribe it as a summarize, I don't prescribe amitriptyline. It's gone are those days you prescribe those drugs. And I say, when you take these tablets, they sometimes take a few days to a few weeks to work. So you're going to presuppose they're going to take them. Right? Then I say, you'll begin to notice them working when, at the end of the day, you look back and notice that instead of being depressed and anxious with all those thoughts running in your head all the time, you know how, so I'll say, you know how, you have these thoughts, and it's racing thoughts, you're thinking about things in the past, worried about things in the future. You know how that's happening? Like, does it happen all the time? You go, oh yeah, they're happening all the time, that's why they're there. You know, I'm finished yet, you can take a picture in a while. And then you go, oh yeah, so they're agreeing with you, right? Because people come and they truly believe they're depressed like 24 hours a day. Instead of being depressed all the time, that they don't happen so often, right? That these thoughts don't come in so often. So at the end of the day, they look back and they go, oh, actually, I wasn't depressed the whole day. When I went to the toilet, I wasn't depressed. When I was washing the dishes, I wasn't depressed. Because we know it doesn't happen. Neuroscientifically, it just doesn't happen. And that they don't happen so often. And in situations when you don't when you would have had them, you'll notice that they just don't bother you anymore. And once you notice that, you start noticing it more and more, and it happens more and more. Until those thoughts don't really bother you as much anymore. Right? So you're going to look back, and you're going to think, wait a minute, I wasn't depressed. And then the next day they go, actually, I'm not depressed. Oh, I'm not depressed now. So, yes, you're giving antidepressants, which do something to your head. But then you're teaching them using a bit of trickery, like I did, a bit of fun, but to teach exactly what I told you, that being stuck is all in your head. And freeing yourself, and the ability to get free, to free yourself, is often within. So you're teaching them the same thing. And I think we need all the placebo we can get. Right? So the key to effective change, when I want to do that one, and so I said, believe the unlikely is possible. Hope you've come and learned today that some of the doctors, some of the have just found out that there's so much more of the world out there there's to help their patients. I've asked people to give, I don't know if you've ever watched my testimonial, I'll put it on the YouTube channel. This lady surely believes that I really helped her with the acupuncture. And maybe I did, but she really got a lot better. And there's, all this stuff is out there, and we don't know. So, and it can be learned. So it can be learned. Like I said, we can teach you these things. You can learn these things. You don't have to learn it from us. You can learn it from anyone. I think you learn everything on YouTube, personally. So reframe everything, which means change the meaning. Reframing means, in CBT it's called reappraisal. That's true, it's really good. It's all about how you see things, isn't it? Everything's just a point of view, like today. It's all just a point of view. Everyone's got their own point of view, and you've got your own point of view, they've got their own point of view, but it's just a point of view. And if you shift it, maybe things will change as well. And remember to lead after pacing, so leave the consultation happy. I think that's my advice, for my registrars. So it's gone well when you're happy and they're happy and you don't have to worry about it, right? And then because you have that niggling feeling sometimes, those are your doctors, when they go home and you think, oh God, you're worried, you wish you'd admitted them, you weren't sure, that shouldn't be the feeling. And come and learn more. So Naveed will sort you out if you speak to any of us in the next couple of days. So get in touch. Tell us what you think about integrative health prevention. You can go to our website and have a look at the course. And then what we'll do is, I'll release the video to anyone here. There's a free membership site. I'll email you all the details later. You can't get everything today on video. I think we're going to do, where's the video? So we're going to do a deal for £50 and you can get all the videos or whatever, because it does take a lot of work to process all those videos. And normally, so we'll get all the videos done. It'll take us about a couple of months. But if you want it for today only, otherwise it's about £200 or something. But we believe that it's essential that you guys get exposure to other therapists and other ways of doing things. So I think it's important for us. Anyway, that's my email address, or you can just put admin, and Naveed and I will get it. So whatever he knows, I know, and what I know, he knows. Thank you very much.